Okay, so thank you for joining us today. This is the Breast Cancer Family Registry. We're speaking today with Dr. Mary Daly. She is the former chair of the Department of Clinical Genetics and of the Cancer Research at Fox Chase Cancer Center. Dr. Daly's focus is on women's health. She has been the founding director of the Margaret Dyson Family Risk Assessment Program. She is also principal investigator of the Philadelphia Breast Cancer Registry and also of the Legacy Girl Study in the Philadelphia area. So thank you so much, Dr. Daly, for joining us today.
Oh, you're welcome. I'm glad to be here.
So you'd like to know some things about your work, many things about your work, as much as you want to tell us. So let's ask the first point here is, how did you become involved in genetics and cancer research?
It's kind of a long story, so I'll make it as short as possible. But before medical school and all of my graduate training, I spent 3 years living in Africa, where I learned how important public health was, which sort of made me want to work in an area of prevention. In other words, employ technologies that would prevent disease instead of trying to treat them. So fast forward to medical school and training, I ended up in medical oncology. I ended up having an important role in women's health, and particularly women with breast cancer. And I wanted to keep the theme of prevention going rather than just doing clinical trials with this drug or that drug, which is also very important. But I wanted to prevent women from having to be treated for breast cancer. And I was fortunate enough at that time that along came an emergence of the importance of genetics. And so that's how I ended up involving genetics into my prevention ideas and using genetics as a way to understand how we could prevent cancers, and specifically women's cancers. So it was sort of a good thing timing wise. I don't know if you know Henry Lynch, but we think of him as the father of cancer genetics. He was starting to publish articles on the familial clustering of cancers like breast and colon cancer. And that kind of gave an impetus to the whole field to move in that direction. And just about that time, we applied for and got the grant for the Breast Cancer Family Registry. So we were primed to move in that direction.
Wow. Very inspiring.
Yeah.
Do you have suggestions for people who are interested in entering the field of genetics or cancer research at this time?
Yeah, I was thinking about that. There's so many different disciplines that are needed in cancer genetics, not just clinicians or basic scientists, behavioral scientists. We need to understand the whole scope of how genetics impacts cancer. So I guess my best advice would be for whatever discipline someone's coming from to find a really good mentor, someone who can lead them through the whole process of understanding the important questions, understanding what role they could have in answering some of these questions, and giving them access to some of the leaders in the field.
And what is one of the biggest challenges in your field right now?
I think one of the biggest challenges, and we deal with this every day, is the technology has exploded. Just in the time of the Breast Cancer Family Registry, the ability to search the human genome has gone from a highly expensive and rare undertaking to something that's done quickly in a very short period of time with very little money. So we can do a lot of searching of the human genome. The challenge is, what do we do with that information? So the technology is way ahead of the clinical understanding of how to use that information. And so we're constantly finding things out about someone's genetic makeup, but not having good recommendations for what to do about it. So we're scrambling to keep up with the technology. And that's where the Breast Cancer Family Registry comes in, because we have this large cohort of families And we can begin to ask those questions within the registry. What does this mean? What do these different genes mean? What kinds of cancers are they associated with? And what do we know about those cancers? So that was a very good pairing of technology and epidemiology and clinical interest in genetics and cancer.
Uh-huh.
Yeah.
What would you say some of the highlights of your work have been? Either what you're most proud of or what findings or developments are particularly important to you?
Well, a couple of things. One is I was lucky enough to get a grant early on in this work to set up a family registry of women with breast and ovary cancer. And without really realizing how important this would become, this was even before the BRCA genes were identified, for example.
Wow.
The ability to do that, one, it showed me this is something that these families desperately wanted. They wanted to be involved in some research. They wanted to know more and more about the cancers in their families. So we were able to start meeting their needs, and we were able to move the research forward with this. And it was having this family registry at Fox Chase that allowed me to become part of the Breast Cancer Family Registry.
Mm-hmm. Well, you've said something about what's important about the BCFR already, but what do you find most exciting about the BCFR's current work? That's the Breast Cancer Family Registry. And what excites you about the registry's future?
Well, it's a cohort that we established in 1995, and it's still active. And by that, I mean we're still following with these families in getting updates on their status. So we have long-term data, over 25 years of data. The families are very diverse in terms of racial and ethnic status, in terms of age, in terms of gender. They include both men and women. And so we're able to ask the questions about, for instance, if you have a BRCA mutation and you don't get cancer, why not? And why does your sister with the same mutation get cancer? So we're looking for factors that modify the genetic risk. And with this large cohort of people, we can, going forward, start asking and answering those questions. And we would be able to, and I think this is where the field is moving, we would be able to say, instead of everybody with the BRCA mutation has this risk, we would be able to say, you, because of this factor and the mutation, you have this specific risk. So we can personalize it for each individual. So I think that's one of the big forces that we're moving towards in the Breast Cancer Family Registry, is to have this, what we call precision prevention.
Mm-hmm. How has it helped to have collaborators in multiple sites? So the Breast Cancer Family Registry, many participants may not know, is in 3 countries and 7 sites total. So how have those collaborations contributed?
Well, it's clear that even within the United States, there's a lot of geographic differences in the populations. The people who live on the West Coast have different characteristics than the people on the East Coast. Mm-hmm. The healthcare systems are different. And then when you add into it 2 additional countries, Canada and Australia, also with different healthcare systems, different traditions and different cultures, it gives us a wide, broad avenue to explore some of these differences. One of the first things we did, just as an example, a long time ago, was we looked at how different sites, and remember, this is when genetics was brand new and everybody was afraid of it, how different sites handled informed consent to be in the registry. Mm-hmm. So each group contributed to that, and we published a paper on informed consent across these different sites and how it differed. And we can look at a lot of other different things. Mm-hmm. As you know, in New York, there's an interesting racial makeup of people that's different from, say, California, which has a lot of Asian people, and Philadelphia, which has a lot of African-American people. So we're able to look at all those differences as well.
Uh-huh. So how has clinical genetics changed since you began working in the field, and how has research contributed to these changes?
Yeah, I think we've been lucky that it's even from the beginning, and when I say the beginning, I'm talking about when we first started learning about genes like BRCA. That's not to say there wasn't a lot of genetic research prior to that, but this is about the first time it got into the clinical realm.
Mhm.
And it was very much bolstered by research. And the BCFR is one example of that. We started doing mutation testing in the BCFR in a research setting so that we would know what the consequences of telling someone what their genetic status was would be. So research has been very important. What's happened over the last 25 years is that clinical risk assessment of genetic risk has become standard. It's no longer just something in isolated research settings. And it's also entered into the therapeutic realm where we're now looking at the genetic makeup of various tumors to see if we can find better ways to treat them. So both in the prevention and in the treatment realms clinically, the genetics has taken a major role, and I think it will only continue to do so. And there's now several new drugs that have been developed by pharmaceutical companies just on the basis of the genetics knowledge that we have of different tumors. So I think it's here to stay.
Uh-huh. For our participants, why do you think participation in cancer research is important, or how would you describe that? And particularly, why is it important that people participate in the BCFR, in the registry? And then what about our new Young Women Study? And what are reasons for young women to join the Young Women Study?
Yeah, we're so grateful to the families that have been in the registry for all this time and not necessarily always knowing what we're doing with their information and what we're doing with their blood samples and their tumor samples. But we've tried to give back as much as we can in terms of informing family members of how their information is resulted in this finding or that finding. We have newsletters at each site so that we can give them information about new discoveries in genetics. And just having this video is a good example of that, as we're trying to share with all of the members of the registry what we're doing, why it's so important, and why they have such an important role in this research. And ultimately, we hope that the benefit will come back to them in terms of better risk prediction, better prevention, fewer cancers forming in these families. So we hope that there'll ultimately be a real clinical benefit to them. The young women's cohort is particularly interesting right now because most breast cancer occurs after menopause, but there's an increase of breast cancer in young women earlier than the age of menopause, which we don't really understand. And so having a cohort of women who are premenopausal, who are still coping with hormonal changes, with having children, being on birth control, all those things that might have some impact on breast cancer, we can now really look much more carefully to see if we can understand what this surge in younger breast cancer is all about. So it will be a really important contribution to the field, I think. Mm-hmm. And so far, we found that as we approach these young women, and most of them are daughters of the older women who are already in the registry, they're very receptive. They don't want to be approached in any other way but online, so that's different. But that's where the research is going. But they seem very receptive. They want to help. They want to know more about their risk and if there are things they can do in their life to change their risk.
So there are things they can do to reduce their risk.
Yes.
Yeah.
We just did a survey looking at the questions. If you were told you had a certain genetic risk, what things would you do? And 100% almost of the responses were they would take more care of their diet, they would get more exercise, they would lose weight. So they already have in their mind ideas of how they can change their lifestyle if they were aware of an increased risk.
If they were told that these issues are risk issues,
Yeah.
then they could take action.
Yeah.
So along those lines, how can scientific research and the scientific community improve how research is translated into clinical practice and guidelines for patients? So these ideas that you're talking about now in terms of choices people can make on their own. And what are some examples in cancer research where this has been done successfully? So where research has been translated and people know how to act on it, that's been communicated. And then any relationship to policy in addition to clinical practice of these findings.
So that's a big question.
Yeah, sure.
I think sort of the hallmark of how this gets into clinical practice is research still. And here's a good example of it is mammography. Even in my lifetime, mammography was not the standard of screening for women until several large randomized trials were performed looking at women who had mammograms at a regular basis and women who did not. And we now have solid evidence that women who have regular mammograms are more likely to have lower stage disease and have a better survival. So it's covered by insurance. All of the guideline professional organizations recommend mammography for women as a way to reduce their risk of dying from breast cancer. The same could be true for other screening. The other big example is colon cancer. It's been shown that in places where colon cancer screening with colonoscopy has become standard, the incidence of colon cancer has dropped dramatically, and people are not even getting colon cancer because of the benefit of colonoscopy. So it starts with research, it starts with clinical trials, and then the healthcare system acknowledges that there's evidence of benefit to these things and embraces them. And I think one of the things that we could do to help all of this is more education. You'd think health information would be more available, but it's really still not that available. When you think about it, the majority of American women and men get their health care from private practitioners who may not be aware as much as we are in the Breast Cancer Family Registry sites of the importance of genetics and how to use it. So we need to help healthcare providers get more knowledge about genetics, and we need the public to get more knowledge about it because there's still a huge underutilization of genetic testing and in large groups of people who just aren't aware of its importance and what it could do for them. I'm sorry, go ahead.
No, I was just going to ask, on the part of the public, do you think there's some fear of genetic testing or reluctance?
Yes, but I think I've seen that decrease dramatically. Yeah, because one of the big fears has been the fear of loss of confidentiality and privacy.
Personal information.
But it's been now 25 years that we've been doing. We really aren't seeing that. So I think people are more used to it. But there's still a fear of knowing you have a high risk of cancer. And it's just very interesting. People are all different. Some people want to know everything so that they can do what they can to change it. Some people don't want to know that stuff. They just think it would be too overwhelming for them. So we need to have the support of the healthcare system to guide them through it.
So speaking of,
I'm sorry, you asked about policy. Yeah, that's something people haven't thought about enough. We think about individuals and we think about clinics and we think about hospitals, but genetics has a huge impact on public policy in terms of having good registries. We have registries now of people who have cancer, but we don't have a national registry of people who have cancer genetic information. That would help tremendously to know what the enormity of the situation is, what kind of resources public officials would need to put in place to deal with it, how public education might be guided. So I think that there's a lot that needs to be done in the public health realm. And I will say the CDC has been a leader in this area of championing the integration of clinical genetics into the public health arena.
Okay, I have a clinical question, and that is, what are the most important or key ideas or things you would share with your patients or tell your patients? So, for example, in terms of actionable lifestyle changes or cancer prevention, if you wanted to communicate one thing to the general population, what might it be?
So I never want to communicate just one thing.
I bet.
But there is one thing that I think stands out in my mind, and that's just because of my experience with genetics, and that is know your family history. And when you think about it, people might know the cancers in their parents' generation, but when you start going beyond that to the grandparents' generation, to the aunts and uncles, to cousins, things get less and less known. And we often get very sketchy information, and that could make a huge difference in terms of what action we might take in terms of their risk counseling and genetic testing. So, particularly in the older generation, now I think back to my grandparents, I wish I'd asked them a lot more questions about their health and about their relatives, and it's too late now. So if possible, know your family history. We always talk about other advice we give to patients about healthy lifestyle. And, it seems kind of trite, but it would make a huge difference if people were following certain, like American Cancer Society recommendations for healthy diets, exercise, etc. One of the things we've actually started putting into our genetic result letters, this may seem a little bit out of the realm of genetics, but a lot of the people who we do genetic testing for have children or maybe young themselves. So we have a standard line in our letter to consider HPV testing. Mm-hmm. Because here's an opportunity to prevent a whole host of cancers with a vaccine. So that we try to keep up to date with all of these things, because people who get genetic testing or learn about their risk are interested in their health, and not just one part of their health, but interested in any advice we can give them.
I guess as we are about to close here, is there anything else you'd like Breast Cancer Family Registry participants or Legacy Girl Study participants to know or want to share with them at this point?
Yeah, I think I just again want to thank the registry participants, all the family members who've stuck with us all these years, many surveys, they keep filling them out and sending them back. I just want them to know that this will make a difference in their lives and in the lives of their children, hopefully going forward, and that we have every expectation of keeping in touch with them for the long term to share with them our knowledge.
Thank you so much, Dr. Daly, and thank you for all your work.
Oh, you're welcome. It's not work. It's just wonderful to be. I'm so fortunate to be able to be alive right now when all of this genetic stuff is happening and I can be a part of it. So I feel very fortunate. Mm-hmm.